Hi, this is Alfred Brock from the CNC News Co., and we're going to be talking a bit about a problem with opioids that is put upon children who are born to parents, to mothers who are addicted to opioids, and there are similar circumstances for other drugs as well. Now, what we're going to be talking about is neonatal abstinence syndrome. That's NAS. It's a condition which occurs when a baby is exposed to addictive substances, primarily opioids these days, while in the womb and experiences withdrawal symptoms after birth. This condition is a significant public health concern, particularly in regions affected by the opioid epidemic. And we're going to have an overview here of NAS, its causes, symptoms, and its incidence in the United States and Canada. So it's just an informational video. Now, what is neonatal abstinence syndrome, NAS? NAS occurs when a pregnant woman uses opioids or other addictive substances which pass through the placenta to the fetus. After birth, the baby is no longer exposed to the substance and experiences withdrawal symptoms. Common substances linked to NAS include prescription opioids like oxycodone, hydrocodone, also illicit opioids like heroin and fentanyl, and other substances like benzodiazepines, alcohol, nicotine can also cause this symptom. Symptoms of NAS can vary in severity and may include tremors or seizures, excessive crying or irritability, poor feeding or difficulty sucking, sleep disturbances, hyperactive reflexes, respiratory distress, fever, sweating, or even mottled skin. And there could be diarrhea or vomiting. Now, in the United States, the incidence of NAS has seen a dramatic rise due to the opioid epidemic. As of 2019, the CDC reported that approximately 7.3 out of 1,000 hospital births involved NAS. And this translates to roughly about 24,000 babies born annually in the United States with NAS and its territories. Regional variation. States with higher rates of opioid use, such as West Virginia, Tennessee, and Kentucky, have seen the highest incidence of NAS. Now, the trends, the rate of NAS increased fivefold between 2000 and 12. That's 12 years. Though recent efforts to address the opioid crisis have slowed the rise in some areas, of course, these are just statistics. It's difficult to tell what's going on, especially to get information out of the health system. Now, in Canada, also experienced a rise in NAS cases, though the incidence seems to be lower than in the United States. A 2019 study found that the rate of NAS in Canada was approximately 5.1 per thousand hospital births, whereas in the United States it's 7.3. Regional variation. Provinces like British Columbia and Ontario have reported higher rates due to urban centers with significant opioid use, and also in the case of Ontario, they've got a more sophisticated system set up there, medical system, so we're getting more information from places that can provide it or find out about it. And trends. In Canada, similar to the US, Canada has seen an increase in NAS cases linked to the opioid crisis, particularly with the rise of fentanyl use. Now, what are the risk factors for NAS? The maternal use of opioids or other addictive substances during pregnancy is a cause. It's a risk factor. There are also risk factors: lack of access to prenatal care or substance use treatment. Somebody could walk right through their entire pregnancy and not realize that they could get assistance. Socioeconomic factors are included, such as poverty and a lack of education. And then, of course, there's polydrug use, which is combining opioids with alcohol or benzodiazepines. And this is a complete lifestyle that some folks are experiencing right now. Treatment for NAS, what is it? There's non-pharmacological care, which includes swaddling, rocking, and minimizing stimulation, as you might normally do with infants, but that can help soothe the infants with mild withdrawal symptoms if they're mild. There's also pharmacological treatment for moderate to severe cases. Medications like morphine or methadone may be used to manage withdrawal symptoms. And then there's breastfeeding. If the mother is in a stable treatment program, for example, methadone maintenance, breastfeeding is encouraged as it can reduce the severity of withdrawal symptoms, so that's great. Then there's prevention efforts. What's going on with that? Education. Now, when I say what's going on with that, I don't mean it's going on all over the place. There's just some things that we could do about this. And in many cases and many places, Nothing's being done. So prevention efforts, education, and raising awareness about the risks of opioid use during pregnancy. That's what we're doing right now, so that's a good thing. Access to treatment, expanding access to medication-assisted treatment, which is also referred to as MAT or MAT, for pregnant women with opioid use disorder. Good idea to get that made available for everybody that's got these problems. Because the interactions between the men and the women, they're all using the drugs, right? So, prenatal care, encouraging early and regular prenatal care to identify and address substance use. Policy changes, implementing stricter regulations on opioid prescriptions and increasing funding for addiction treatment programs. A lot of this is caused by the manufacture of so much of it. The illicit opioids are also a lot of times prescribed opioids that just find their way out of the supply stream, let's put it that way. So let's take a conclusion right now, and then we're going to have some more information, so hang in there. The neonatal abstinence syndrome is a preventable condition that has become a significant public health issue in the U.S. and Canada. The rise in NAS cases is closely tied to the opioid epidemic, highlighting the need for comprehensive strategies to address substance use during pregnancy and at any time, right? Efforts to improve access to treatment, education, and prenatal care are critical to reducing the incidence of NAS and ensuring healthier outcomes for mothers and babies, and of course, everybody. So let's go on, and we're going to get just a few more paragraphs. So neonatal abstinence syndrome and other conditions linked to maternal or paternal drug use can be fatal to newborns in severe cases, though many infants survive with appropriate medical care. But it does happen where the child could lose their life. So let's take a look at neonatal abstinence syndrome, NAS, and fatality risk. NAS occurs when a baby is exposed, as we know, to opioids or other addictive substances in the womb and experiences withdrawal symptoms after birth. While NAS itself is rarely fatal, complications caused by or exacerbated by withdrawal can be life-threatening. Potential fatal complications of NAS include respiratory distress, that's difficulty breathing, severe dehydration from excessive crying, poor feeding, diarrhea, and vomiting, seizures, which can lead to brain injury if untreated, and then low birth weight and premature birth, which increase the risk of organ failure and infections. And then there's a sudden infant death syndrome, referred to as SIDS. Babies with NAS are at a higher risk, apparently. Heart problems or arrhythmia, depending on drug exposure. Now, with proper medical care, NICU support, medications like morphine or methadone to wean the babies off opioids, most infants can recover, though they may experience this still happens, long-term developmental delays or other health issues. So there you have it. We talked about neonatal abstinence syndrome, NAS. Thanks for listening, and live healthy.